Hello, my name is Dr. Manish. I am a pain management specialist. Today my topic is on shoulder pain, and there are patients who complain of a particular right or left shoulder pain for long duration, for more than 3 months or 6 months, and commonly this is diagnosed as frozen shoulder. So coming to the area of shoulder pain, what happens? These actually hamper the daily activities like overhead work and combing the hair and traveling by bus or train where you have to hold the railings, overhead railings and all, and those can cause daily activity hampering pain. So for that we need to know what is the idea of shoulder and what is the shoulder pain actually consists of. So this is a small model of shoulder we are saying. So this is basically the bone in the main bone in the arm, that is the humerus, and there are two other bones which form the shoulder joint. One is the scapula, which is basically the in the back region, and there is also clavicle, which is the collarbone. So these are the areas which form the shoulder joint, and there are a lot of sources or pain generators around the shoulder joint which has to be identified clinically and also by different investigations, so that we can know the source of pain rather than directly marking is at frozen shoulder and give some painkillers and physiotherapy. So for shoulder pain, there was a common areas which is called as frozen shoulder. It is called the adhesive capsulitis. Like there is a small capsule, and like it's a covering of the around the shoulder joint, and that can cause adhesion. It is causing adhesive capsulitis, kind of inflammatory condition where there is decrease in range of motion of the shoulder, and it happens due to many causes, iatrogenic causes. It may be due to diabetes, hypothyroidism, these are predisposing risk factors, or different strain and sprain. So this is the frozen shoulder. What are the other areas? Osteoarthritis can be a cause, which is present in the knees mostly. In the shoulder also there might be osteoarthritis, where there will be difficulty in moving the shoulder overhead and passively, but when we do it actively also there will be some difficulty in movement of shoulder, but there will be pain, mostly limited of range of motion, but pain will be limited. Mostly the range of motion, there are two areas. One is the painful range of motion, one is difficulty in elevating the hand because of the osteoarthritis and all. And whenever there is painful, it can be due to many other causes. So these are a lot of muscles that are actually present around the shoulder joint. So there are four major muscles which are called the rotator cuff, which actually hold the shoulder joint in position because it's a very labile joint. It gets dislocated very easily. So these four muscles get attached to a particular area of the bone, and whenever there is an attachment near the shoulder joint of those muscles, there are some that is called the tendon, which is the attachment between the muscles and the bone. Whenever there is tendon is getting it might get tear, it might get inflammation, like tendinopathies or tendinosis. Those can cause a painful range of motion of the shoulder joint. So we have to identify the particular ranges of motion of different muscles, whether they are painful or not, or whether there is weakness during the movement of the shoulder joint or not, so that we can identify the which muscle is getting having the problems of the shoulder joint area. So those are the areas. Another is the bursitis. So there is a small area or small pouch of fluid between the muscle and the bone. When there is an inflammation, it can cause bursitis, and those can be a cause of shoulder joint pain. And other areas, what are those? And it might be due to any kind of osteoarthritis of the other joint. There is the acromioclavicular joint, which is another joint here, which is not near the shoulder, which is just above the shoulder and towards the neck, and those can be a cause of shoulder joint pain. And another is the muscle or myofascial pain, which is very common, which is commonly seen in different continuous working by sitting, and also continuous neck is stooping downwards and all. Those can cause severe pain in the neck muscles, which might mimic as a shoulder joint pain. So those areas has to be identified with clinical examination, and by seeing it, trapezius muscle is the most commonly affected muscle. It can cause those kind of shoulder pain. So whenever there is a shoulder pain and there is a decrease in overhead activities or range of motion of the shoulder, we have to identify the source by taking history and examination of the particular patient to know whether there is from the joints, or whether there is from the bursa, whether this is from the capsule, which is adhesive capsulitis, or whether this is from the muscles or the myofascial region of the neck or near the shoulder, where there is an attachment of the shoulder muscles to the bone, the tendinosis or tendon tear or tendinopathies. So these are the common areas where we have to identify the source By identifying the source, we actually help the patients to manage it. How will you manage? The management of pain is actually depending on the diagnosis of the source. And if there is a inflammatory condition inside the joint, we have to give an intra-articular injection. And whether there is a tendon tear or if there is a partial tear, a small tear in the muscles, we can inject a small amount of PRPs, that is platelet-rich plasma, or some dextrose, which will help in healing of that particular tear. When there is a total tear of the joint, total tear of the muscle, then usually the surgical referral is done in orthopedics and the surgical repair of the muscle is required. That is called as a red flag sign when there is a total drooping of shoulder rather than maintaining that position. And also there are different kinds of injection of the nerve injection, so that the shoulder pain is reduced, and after the pain reduction, the shoulder mobilization and strengthening exercises can be done, so that the shoulder range of motion is increased, and the daily activities that was initially hampering it is actually getting recovered. So for shoulder pain, usually the primary you have to diagnose, first you have to consult the pain physician, then diagnose the source of pain, then start with the basic analgesics which are required, and some warm compression can also help, along with the if there is no inflammation but there is pain. And fourthly, when there is a no relief of pain with the conventional methods like analgesics and anti-neuropathic agents which will help in reduction of pain, we have to give some injections. So injection usually is given in the nerve, which is located near the suprascapular notch. So there is a particular notch, I don't know if you're able to see here. So the main or 70% of the nerve supply goes through the suprascapular nerve. So we identify this particular notch here by ultrasound. By keeping the ultrasound here, we see it through the ultrasound, and we inject near the nerve so that the shoulder pain is reduced to 60 to 70%. Whenever there is a reduction of shoulder pain with this nerve block, then after 2 weeks, we try to give you some exercise regimes like shoulder mobilization exercises, so that the movement is gradually increased and the pain is gradually coming down. So take home message from this particular video is that whenever you're feeling shoulder pain, try to consult a pain physician to identify the source of pain, whether it's coming from the neck, whether it's coming from the shoulder, different pathologies or different areas of the shoulder. And after identification of the particular area by history and examination and some investigations like USG or MRI, we try to manage it by giving some conventional methods, and if it fails, we can give some injections or nerve block or intra-articular injection or near the area of the pathology where there is a tear, where there is a tendinopathy, so that the pain is controlled and your range of motion is increased, so that your daily activities are not hampered. So this is the take home message from this video. So if you have any questions about shoulder pain, please give your comments in the comment box, and I will try to reach you out. Thank you. Stay blessed.